across Africa, more than 17 countries have reported such cases of Mpox in the last 12 months alone.
You're listening to Blue Radio, bringing the vibe.
What is Mpox? Mpox is an infectious disease that is caused by the monkey virus. How do you know? How would you know that you have Mpox? So number one, you'd have fever, yeah, and then number two, you'd have enlarged lymph nodes. Lymph nodes are usually found, I think, somewhere around the neck, here, the neck region, and somewhere around the thigh region. So once they start swelling, it could signal to you that something is definitely up. And then also there is rashes. You could develop rashes that are itching, yeah, and they are swollen, or they swell so much on your skin. So very, very visible across the skin. How can it spread? How can it move from person X to person Y? All right. So number one is through touch. Yes. Because we said it's visible on the skin. If somebody who is infected touches your skin, you are more likely to get it. Sawa. It can be spread through kissing. It can be spread through, yes, you heard me right, through kissing. It can be spread through mother to child. If a pregnant mother has it, there is a possibility she could pass it on to her child. All right. Now, this particular new variant that has been discovered in Kenya was actually discovered sometime between July 29th and July 31st, thereabouts. So there was a truck driver who had traveled to Uganda, Rwanda, and Tanzania. Yeah, so while he was coming back to Kenya through the Taita Taveta border, while inspections were happening, the guy was discovered, or rather was, diagnosed with the same. Now, the Ministry of Health yesterday, that was on Tuesday, took to their social media accounts and actually, or rather did a presser to actually confirm that yes, indeed, patient 0 has fully recovered, and patient 0 has fully recovered, but they're still continuing to monitor him, and they're trying as much as they can to trace any persons they had contact with, because remember, this is a communicable disease. It can be passed through somebody could touch you, somebody could touch a surface where you are. Once you touch the same surface, you could get it. Somebody could give you a hug, you could get it. Yeah, if it's your partner, while you're having relations, they could transfer it to you in that similar situation. Now, the World Health Organization, in collaboration with some of our health practitioners, did tests on this patient 0, and they discovered that this is a new strain. Yes, something that was actually experienced in Congo has been discovered in Kenya. Now, how did this come about? Well, like we said, it could be through touch, it could be through sexual relations, it could be through various means. Okay. And so the Ministry of Health have discovered that this new strain is a very infectious one. It's a dangerous one. That's what they're saying. It's from a variant called Clade 1 variant. Across Africa, more than 17 countries have reported such cases of Mpox in the last 12 months alone. Sawa. So more than 17 countries across Africa have reported this particular case.